दे।
औज़ु बिल्लाहि मिनश शैतानिर रजीम, बिस्मिल्लाहिर रहमानिर रहीम। पाकिस्तान एसोसिएशन के तावन से, पीएमए के तावन से और वुमेन मेडिकल कॉलेज एबटाबाद और AJKMC मुजफ्फराबाद मेडिकल कॉलेज के तावन से ये 12वां सेमिनार है। और आज के सेमिनार के हमारे जो स्पीकर हैं प्रोफेसर खालिद हैं। प्रोफेसर खालिद खान इज ए ग्रेजुएट ऑफ अल्लामा इकबाल मेडिकल कॉलेज। प्रोफेसर खालिद खान इज MRCP और FCPS. He is running Department of Medicine Gastroenterology, Jinnah Hospital, Allama Iqbal Medical College, Lahore. He is a faculty member of CPSP, President American Iqbalian Welfare Society, President Lahore Chapter Pakistan Society of Internal Medicine, PSIM, Vice President of PMA. हमारे दूसरे स्पीकर जो हैं वो स्पीकर कम है, बल्कि उनसे उनकी कोलैबोरेशन हमारे साथ ज़्यादा है। प्रोफेसर बिल्किस एंड आल्सो ये हमारे जो फोर्थ कोलैबोरेशन है, कोलैबोरेटिव्स हैं, वो किंग एडवर्ड मेडिकल यूनिवर्सिटी है। नो डाउट प्रोफेसर बिल्किस नीड टू इंट्रोड्यूस एवरीवन, बट my honor, Professor Bilkis is a graduate of, she is graduate of Fatma Jinnah Medical College. She is daughter of our teacher Professor Shabir Naru, and Professor Shabir is running Department of Medicine in King Edward Medical University, and she is also a pioneer in introducing the telemedicine. Another speaker is Professor Abdul Khalik. Professor Abdul Khalik is also graduate of King Edward Medical College, जो उस जमाने में था 1994, और अब वो यूनिवर्सिटी है। Professor Khalid is a renowned physician. He is a good teacher. He is running DME in King Edward in Azad Jammu Kashmir Medical College, Muzaffarabad. Professor Khalid is a big force with me to make the curriculum and other things at the Muzaffarabad Medical College. Another speaker is today's speaker. Another panelist is Professor Muhammad Munir. Professor Munir is a graduate of King Edward Medical College. Medical College is a senior most. He is a graduate of King Edward Medical College 1977. He did the MPhil and he visited America and Japan for his further post-graduation in virology and bacteriology. Now it is over to Professor Rashid for the recitation of the Holy Quran. Today, so many our speakers are from international level. Sir, unmute kar le aap. So we'll try our discussion in English, sir.
शुरू करें सर?
जी सर.
अऊज़ु बिल्लाहि मिनश शैतानिर रजीम, बिस्मिल्लाहिर रहमानिर रहीम। इन्नल्लाहा ला यस्तही अन यद्रिबा मसलन मा बऊदतन फमा फौक़हा फअम्मल्लज़ीना आमनू फयअलमूना अन्नहुल हक़्क़ु मिर रब्बिहिम वअम्मल्लज़ीना कफ़रू फयक़ूलूना माज़ा अरादल्लाहु बिहाज़ा मसला युदिल्लु बिही कसीरन व यहदी बिही कसीरा वमा युदिल्लु बिही इल्लल फासिकीन। तर्जुमा।
जज़ाकल्लाह।
अल्लाह इस बात से आर नहीं करता कि मच्छर या इससे बढ़कर किसी चीज़ की मिसाल बयान फरमाए। जो मोमिन हैं वो यकीन करते हैं वो उनके परवरदिगार की तरफ से सच है, और जो काफिर हैं वो कहते हैं कि इस मिसाल से खुदा की मुराद ही क्या है। इससे खुदा बहुतों को गुमराह करता है और बहुतों को हिदायत बख्शता है, और गुमराह भी करता तो नाफरमान ही को है। सदक़ल्लाहुल अज़ीम।
प्रोफेसर खालिद, आज बहुत सारे खालिद मौजूद हैं हमारे पास, प्रोफेसर खालिद अवान, प्रोफेसर खालिद खान और प्रोफेसर खालिद पल्मोनोलॉजिस्ट भी मौजूद हैं. थैंक यू वेरी मच सर फॉर ज्वाइनिंग. प्रोफेसर खालिद also pulmonologist also spent a lot of time with us at King Edward Medical University. Thank you sir for joining us. So before I start this seminar, this webinar, I am also thankful to Professor Salma Kundi. She is president of PMA Pakistan Medical Association and she is principal at Women Medical College, Ahmedabad. With this collaboration and very thankful madam starting this webinar. Today, before I give this mic to the Professor Khalid Khan, I will first of all request my Professor Khalid, what is the condition of dengue at Muzaffarabad and how you are managing and what are the different complications, because Dr. Khalid is facing problem in sharing his presentation. Professor Khalid Awan, Professor Khalid Awan, unmute yourself, sir. Yes, sir. Professor Khalid Awan, unmute yourself.
Okay. Can you hear me now?
Yes, we are hearing, sir.
Assalamu alaikum. Sir, it is the now third episode of this hyper endemic in Muzaffarabad. First, we had it in 2015 and then in 17, and now it is the third time we are facing it. Muzaffarabad is again one of the cities which is affected most by this endemic. And it is now hyper endemic in AJK as it is in rest of the Pakistan. The situation in Muzaffarabad is that now all the medical units in AIMS, which is the hospital, tertiary care hospital where I am working, are now converted into basically the dengue units. Very little is left with us to accommodate other patients. A large number of patients are now coming to us, and we are obviously managing these patients. The good thing is that as it is going up, the what happened with the COVID, that when COVID was going up, all other infections and especially viral infections were going down, and we had nothing much to treat other than COVID at that time. And now it is happening with the dengue in our setup. Dengue is sharply going up, and at the same time, COVID is going down, and rest of the viral infections and other infections are going down. So this is what we are having these patients now with plenty of experience from the previous episodes. Most of these patients now we are managing on OPD basis. We are not admitting most of these patients. Almost 70 to 80% are patients now going home, and only those patients which have some warning signs, warning features, sick patients, we are only admitting those patients. Luckily, we during the previous episodes, we have very good results of these patients. We just lost one patient in 2015, and then in 17 again, it's just one patient. In the present scenario, we have already lost one patient, but most of these patients are making a good recovery, and we are sending these patients home. Obviously, the reason for admission is the warning features and sometimes severe COVID in these patients. Those patients who are unable to take orally, they are having vomiting, persisting high-grade fever even after 4 days, and obviously the cytopenias, leukopenia, and thrombocytopenia. The threshold which we have adopted for us is around 50,000. If patients are approaching to that, then we are admitting those patients. If patient is unable to take orally, they are dehydrated, and if there's hematocrit rate is rising, those are the patients we are admitting. Obviously, the management is in a general ward, but we do have an area in which we admit critically sick patients, and obviously the fluid management and all those things we are doing in these patients. The unfortunate thing is that the level of government involvement to tackle the disease, as it was obvious during the previous hyperendemics, we are not seeing that. That may be just my observation, but the involvement of the community, the mass media campaigns, and the involvement of the government at that level, which is required at the moment. Maybe there's some lacks in that effort. Otherwise, whatever is possible as treating physicians, we are doing that. Obviously, it is not the problem of the physicians. It is, unfortunately, has become the problem of physicians. It is a community health problem, and those are the people who should be taking care of this thing. If there is any questions, I think Dr. Khalid, maybe if he is able
at
to.
the end, we will ask the questions.
Right. Okay.
Okay. Now I will request Professor Bilqis. Professor Bilqis. Madam,
Assalamu alaikum. Thank you, Mulazim Hussain Saab, and I think your services regarding COVID have been remarkable. We started off with a very high percentage of positivity rate across the country as well as in Azad Kashmir, and your efforts in educating the doctors and the family physicians has shown its effect, and alhamdulillah, we are entering into the safer range as far as COVID is concerned. But now that we are talking about dengue today, I'm sorry, my connection lost a few moments back when Professor Abdul Khalid. Yeah, but I lost connection when Professor Abdul Khalid started his talk. Maybe he did talk about it, but I would like to talk about it again, because the history dates back to the year 2011, when we were facing with a huge crisis of COVID. I remember I was an associate professor at that time, and just talking about Mayo, I'll just talk about Mayo in order to give the exact picture, because I was working there at that time as well. And believe you me, there were 6 wards absolutely allocated to dengue, and all the patients were in the leaky phase. That was the biggest crisis we saw over the decade. And then over the approaching years, I remember the role played by Professor Faisal Masood Sahab, may Allah grant him highest place in Jannah. He played a key role in helping us understand the management, the pathogenesis, and the follow-up and monitoring of a dengue patient with the help of the education which was provided by the government of Punjab through the teams coming from Sri Lanka and Bangkok. And I very clearly remember Dr. Fernando, those who were in the field at that time, the senior lot, who are many of the people I'm seeing on the screen, were actually managing the patients at that time. They would remember, I remember the distinct words of Dr. Fernando, who is a pediatrician from Sri Lanka. His words were that no patient should die of dengue. And I remember that prior to this epidemic, we used to be giving megaplatelets blindly. If we opened the books up, which included all the reference books, talking about, I remember Harrison, I opened the book up, I very clearly remember, about the management of dengue patient. There was nothing like description of the leak syndrome. There was nothing like monitoring of a patient. There were no limitation as to not to give platelets. There was no advice about the amount of fluid, which I'm sure Professor Khalid would shortly be talking about. The type of fluid, when to give which fluid, and the 48 hours of the leaky phase, which were critical. This we learned in the year 2011, and following that, almost every year we did have the epidemic and the endemic. It is an endemic.